Hi, and welcome to the show. Subscribe at kevinmd.com/podcast. Get CME for this episode by clicking on the CME link in the show notes. Today on the show, we have Jay Shah. He's a cardiologist and healthcare executive. His Kevin MD article is titled, Only Physicians Can Find a Balance Between Tradition and Active Disruption. Jay, welcome to the show.
Thank you so much for having me, Kevin. Appreciate it.
So we'll get into your article in a little bit, but first off, just briefly share your story and journey to where you are today.
Yeah, of course, sure. I mean, I started as, like probably a lot of physicians growing up wanting to be a doctor for a lot of reasons. And then did my medical school at the University of Missouri in Kansas City. So like a city general hospital, which was great. And it was a great place to be a medical student and learned a ton. And then by luck or chance or a combination of both, ended up at Mass General for internal medicine residency, which the best thing that happened there is I met my wife and we did our cardiology fellowship at Washington University in St. Louis. And then I did something quite different. I think a lot of my mentors thought I was kind of nuts. I went from those sort of major, huge hospital organizations and started my own practice in Portland, Oregon. So like solo practice and within metropolitan Portland, and built that over 7 years into a very large, very busy cardiology practice. And then over the last 3 years, the last transition that I had in clinical medicine was I moved down to Mayo Clinic. We had an opportunity, and I started the thoracic aortic disease program at Mayo Clinic in Arizona, and sort of built that into a sort of national and international referral center. And then over the last 18 months, almost 2 years, have transitioned from that role into the chief medical officer of a startup. And so that's been my last couple of years, and it's been an amazing adventure and a great ride. So that's my story professionally. Of course, I have a family and 2 children, and that's my joy and passion, outside of work.
Now, there are some doctors who, once they become an attending and get out to practice, they kind of do that same thing for whatever, 30, 40 years for the rest of their professional career. But you've pivoted a few times. You went from, of course, training at MGH and Washington University to private practice, to Mayo Clinic, and now your startup. So tell me the impetus between these career pivots.
I think if I had to boil it down to one thing, I would say it's just a desire to try something new and a desire to learn. And I think that repetitively over the course of this last 20-year sort of career journey, that's always been the impetus for me. And so, for example, going from Washington University, this 1,000-bed hospital, giant clinical, academic and training program, to starting from, 1 room, 1 MA, and 2 EKG machines, it's just a huge difference. And so the amount I learned in those first years of practice, not only just being a clinician, being a doctor out of training for the first few years, which when you learn the most for clinical, acumen, but also learning up how to set a practice up, how to run the business, how to hire people, how to manage staff, how to, do all those things that it really takes to run your own, practice, was incredibly valuable and incredibly interesting. And same thing again, going to Mayo Clinic and starting a program, within a large organization. And again, same thing, going 90 degrees and starting, from scratch in a sort of a health tech, digital health industry as a chief medical officer. So it's always been that focus on where can I learn more? What am I going to gain myself for my own knowledge and my own education with these pivots? And that's really what I think initially subconsciously thought about, but now actively think about, is that how are these changes going to help me learn and grow?
So talk about that transition from clinical medicine to now you're healthcare executive at a startup. How was that transition?
It was interesting. You're going from a very, and I've been practicing for over 10 years, right? And full-time practice. I'd never done anything else. Didn't do much research, and just busy clinician. And you're going from that, which we are experts at, right? I mean, most of your listeners are probably experts. You go in, you can knock it out, you see the patients, you do a great job for them, and you just, you're just rolling sort of. And you go from that and to an environment where there's no patients, there's no practice setup, there's no real structure, into a startup world where you're a novice. And that is a significant shift. And into sort of realizing you have to go back to sort of learning mode, realizing that, things are not going to be as structured as you have had them for decades. I mean, how all of us in medicine, it's always structured, everything we've done in clinical medicine. And so that was a big shift. The other big shift is not being the expert in the room always. You know,
Sure.
you have your medical expertise, and that's why companies and industry rely on you. That's why they want you in the room. That's why to bring your clinical expertise, you have that. But most of us have had to, or will have to, learn the business side, marketing, commercial, research, development, operational stuff. You have to learn a lot of those aspects, which I loved and I love doing, which is why I want to do it. But you come in as completely unaware, generally speaking. I would say most of us would, into that world. So it's a somewhat of a risk in that regard, and I think would scare some people. But I think and it scared me. I'm no doubt about that. But it also excited me, and it also was. These are the things that I knew I would learn a lot about, and I wanted to. And so that's the major shift.
So you started a private practice, which certainly gave you that crash course in business training. Other than that, did you have any other formal business background before you jumped into this role at the health startup?
No, not really. I mean, I've done some angel investing and done some sort of different types of investing, real estate, that kind of stuff, but nothing in the formal business sense. Like I never got an MBA, never went to do finance courses. But I think a lot of clinicians underestimate their acumen from a business side, especially those who are in the private practice world, or who are in larger administrative roles in bigger organizations. So for example, within my private practice clinic, I built that cardiology department out. It did have an umbrella organization that had a lot of primary care and other specialties. And for 5 years, I sat on the board and helped run the organization. So that doesn't come with an MBA, but that is tremendous experience, you know, managing people, understanding business, understanding budgets, we've had to do that. And I think a lot of us underestimate, downplay that type of experience. And I think that even the traditional types of leadership that we have in clinical medicine, leading trainees, fellows, residents, you're managing people, you're managing teams. Like, you have that experience. We've had all of that experience. And I think it's crucial that we don't forget that, especially if you're looking to transition. Those are incredibly rich and valuable experiences that you know, can be parlayed into a business environment.
All right, let's talk about your Kevin MD article titled "Only Physicians Can Find a Balance Between Tradition and Active Disruption." Now tell us, how did this article come together?
So as I've been doing this role as chief medical officer in this startup world and business world for the last 18 months to 2 years, one thing I've noticed is that there's a clear lack of physician voice, provider voice in this world. You know, I'm sitting with VCs, going to these large healthcare innovation conferences, and the number of practicing physicians, nurses, providers who actually see patients, less than 5% in the audience. So there's all this talk, noise, people, companies, efforts, money into trying to disrupt healthcare and trying to make it better in certain ways, or a lot of ways, make it more efficient, make it more, you know, whatever the goal is. But the physician voice is largely absent. And what happens that when I sit there in the audience or I'm participating in panels, what is clear to me is that the people trying to make a difference in trying to make the, you know, improvements in innovative sort of companies and businesses really oftentimes have no voice from someone who actually does the work of clinical medicine. And so there's incredible value in, you know, practicing medicine and bringing that to bear in this sort of in the efforts of innovation. And so just as an example, within my own company, I'm the only physician voice right now. And so a lot of times what happens is people will come up with an idea or a change to the product or an idea about where the product should go. And then it, you know, generally with interaction with them, we totally shift. We go from one idea and shift it to something entirely different based on, you know, our clinical expertise and our knowledge of what would actually work in practice, what wouldn't work, where there are too many hurdles to really try something versus where there's a real opportunity for improvement. I think that's what, you know, that's what's the genesis for that article, of really wanting to let other physicians know to empower themselves that their experience and their knowledge is tremendously needed in this space.
Now, what do you think are some of the root causes why there are so few practicing physicians in the health tech startup space?
Well, we alluded to some of them. Is that I think it's scary a lot of times, going from clinical practice to this world is complete 90-degree turn. And generally, depending on your specialty, generally your income will go down. There's a lot more risk involved, right? You're taking compensation in the form of equity a lot of times rather than cash compensation. Startups fail, so there's a risk involved that doesn't generally exist when you've gone through and after we've done all our training and being in practice and you have a great practice that's successful or you're in a good place. That's a fairly comfortable place to sit. It may not be as exciting perhaps, or maybe some people do find it, engaging for a long period of time, but I think that there's a safety in that. And so that's one hurdle. The other hurdle is what you mentioned as well before, is that, and I found this, when I was looking to try to transition into this field, oftentimes the companies that were looking for medical people were looking for people with experience in a business sense. So how is a clinician who's done full-time clinical work, who tells a company that, well, look, I have skills that would apply, but I haven't actually done something on my CV to represent that. And they don't necessarily buy what, that I said, like, well, you have medical experience and that comes with a lot of business acumen and training and management of people. They don't really quite understand that. So they understand it from the framework of a more traditional business sense. So if you're coming from like a strategic company like a Medtronic, that gives you a lot of cachet, so to speak, even though you're not a practicing clinician, over someone who's applying as a practicing clinician who says, I've never done this before, but I look at all this other experience I have. And so there is a hurdle to clear, that you got to get your foot in the door in some respect. Once you get your foot in the door, then the door is open, because then all of a sudden you're a practicing clinician with some business experience. But it's getting that foot in the door that's at least my experience was a little bit harder.
So what are some of the solutions going forward? Because physicians who continue to see patients, they themselves are already overwhelmed. Physician burnout rate 60%, and in the primary care world, you spend a day seeing patients, you go home charting at night. There's just not a lot of bandwidth left for anything else. So for those physicians who may be interested in either diversifying their professional life, so they can be part-time clinical and part-time with health innovation, what do you see as some of those solutions going forward?
The first is being willing to kind of get off the hamster wheel a little bit, or at least slow down. So like you said, I was in practice where I was going 5:30 a.m. to 6 p.m. daily, 5 days a week, weekends, call, all the things you just said. And that doesn't give you time or energy to explore other things. So actively making the choice that says, I'm going to take half a day, I'm going to take, every afternoon or a few hours a week, and I'm going to do this other work. And I'm not going to do clinical practice. I'm going to shut down Epic. I'm going to turn off the computer and I'm going to go look at something else. So I think that's an active choice. That's something that's in our hands. Then I think it's a matter of dipping your toes in the water to see what works. And we have a built-in advantage in that we can generally, most of us can modify our schedule, still practice, but modify our schedule and reduce that time so that we have time to look at other things and try other things. You still have your safety net, you still have your income from your clinical practice, but you can do some consulting work. Maybe you do some advisory board work. There are plenty of opportunities there, just a couple hours a month. Doesn't make much money. That's not the point. The point is to just try and learn about these other aspects. And then what happened for me is that I tried a few consulting roles, and I did that for 6 months, 12 months. And now all of a sudden you have some experience as a consultant in the business world, and like starting to listen to those conversations and understand the sort of lingo and the talk and the emphasis and what people are thinking about. And so then if it comes time to say, look, I want to try something new, try something totally different, and you find an opportunity that you want, you would have some experience, you have some idea of what you're getting into, and you still have, done this with the safety of the clinical practice. And then the last thing is that generally, and this happened for me, most companies other than large strategic big companies are not going to want to pay a physician's salary upfront full time. I think that's great, actually. It's a downside. It seems like a downside, but it's not, because what you generally can negotiate is a part-time role. So you say, I'm going to keep practicing 3 days a week. You're going to get my time 2 days a week for this amount of money or whatever compensation that they're going to offer. So for 6, 9, 12 months, you try it out. Try before you buy. You can just sit there, go through the meetings, learn about the product, learn about the team, learn about the company. And if it's not right for you, okay, I'm out. I'm going to go back to clinical practice, and I've tried it and I didn't want to do that. Or if you say, look, I want to jump. This is a great opportunity. I like this team. I like what they're doing. I feel comfortable now. It's been 9 months. I feel comfortable with this. That's how I think we get to the point where we can really make that transition in a comfortable way. And I think the last part is not ever feeling like you are leaving clinical medicine forever. I think a lot of people feel that way. It's like, if I jump, did I do this? I'm wasting my career. I'm wasting all this time that I've put into clinical medicine. That's not true. In fact, you're using all that knowledge and that experience that you've gained for this much better or different or more exciting opportunity that's going to engage your brain in a different way and make you more passionate about what you're doing, hopefully. I think those are the things to remember. And that's how I would, advise people if they want to make that transition.
Now, let's say if you're a physician, decided to make that transition, cut back or adjust the hours, and I want to go up looking for some of these opportunities in the health innovation space. What's the next step for that?
So first of all, use your network. Will you be surprised at how broad our networks are after doing all this training and work that we've done? And generally people have gone through different institutions. If you at all are active on LinkedIn, which is generally where that's the sort of platform for most of these sort of business and social media platform, make your profile, make it robust, and go start searching your LinkedIn network. You'd be shocked at who you couldn't probably get in contact with. And this was my experience. And I did a tremendous amount of informational interviewing, and I really would just connect with physicians in all these different roles. And a lot of times they were just cold calls. I would just email those physicians, say, look, I'm a doctor too. I'd be curious to how you got into this role. And I'd be curious about what this role actually means. Like, what does the chief medical officer for JP Morgan do? I have no idea. So I'm going to email this guy. And they respond 95% of the time. They're a physician. They've done this before at some point in their career. They'll say, oh, okay, sure. I'll give you 15 minutes of time and talk on the phone. And it was easy. It was so easy to get in contact with other physicians. They were willing to give their time and energy to give you perspective. It was extremely easy. So in that way, you can really use your network to really learn more. And then, as I said, you can look on the LinkedIn opportunities. There's a tremendous number of sites that are for consulting or advisory type roles that are very small, part-time, or even hourly. You can just kind of dip your toe and explore the whole space, explore your specialty and the companies that are around in that space around your specialty, because those are going to be the more likely ones to give you opportunities. And that's how I would start.
We're talking to Jay Shah. He's a cardiologist and healthcare executive. His Kevin MD article is titled, Only Physicians Can Find a Balance Between Tradition and Active Disruption. Jay, tell us some of your take-home messages that you want to leave with the Kevin MD audience.
Well, the main thing I would say to just anyone who is just to never stop learning, never stop looking to learn, never stop looking to grow. And I think that's become more in the mainstream of having this growth mindset. And I think for physicians and clinicians, that means that maybe looking outside of your comfort zone and looking outside of the lanes that we're just, staying in. And I think the second thing I would just say is that never underestimate the amount of experience and education that we, as it relates to trying something new, that we have through our training, through our work, is a tremendous wealth of knowledge. And we should never undersell that or underestimate how valuable that is. And I think we do that a little too often. So those would be the two things I would recommend.
Jay, thank you so much for sharing your time and expertise. Thanks again for being on the show.
Thank you very much, Kevin. I appreciate your time.